my question is this. So some women economists who study labor markets have started calling this current recession, the COVID recession, the recession, the she-cession. Can you describe that?
Yeah, so that expression, I think it's actually called she-cession instead of recession. And it was Nicole Mason, who's the CEO of the Institute for Women's Policy Research, that first came up with that term in a New York Times interview back in the spring. But the reason we're calling it that, or we're calling it a female-dominated recession, is because we've seen an unusual increase in female unemployment during this particular recession that we haven't seen before. And the reason for that impact, the high increase in unemployment that we saw earlier in the spring in particular, which hasn't recovered yet for women, even in the fall, is both, the reasons are both on the labor demand side of the economy and the labor supply side of the economy. So women in this recession have been kind of hit by a double whammy, like on both sides of the market, and very different from the last recession, actually any previous recession, economic recession we've had, but especially different from the Great Recession, the last recession, in that during the Great Recession, we saw most of the jobs that were lost were concentrated in male-dominated occupations and industries. So most of it was happening in manufacturing and construction. And women actually fared relatively well compared to the men, because women tend to work in occupations and industries that are hard to offshore or automate away, because they're very service-intensive industries. They're human service providing industries that where you are providing your work in person to people. And so of course that used to be a really safe kind of job prior to the pandemic, but during the pandemic, that's exactly the worst kind of job to have in terms of being able to continue to work and having the businesses and organizations that you work for continuing to serve people. So that is why it's the she-cession, or a female, very female burdensome recession this time.
I think we should end the segment by asking, are there any specific policies that should be implemented in response to these trends that you've described?
Well, you know, I think the most important thing to help both women and men in terms of the economic recovery is to just get the coronavirus situation under control, because what is preventing women from getting back to work, women in particular, is of course not just the fact that the businesses they work for might not be safe to reopen, but because the kids are home from school, because it's not safe for the kids to be back in school. So I think the number one constraint on the economy right now is entirely related to the public health crisis. Beyond that, so I think that all that we can do while we're waiting for the public health crisis to resolve itself through, better, better social distancing, better practices of people, behavior of people, and the vaccine. So we're just kind of waiting for all of this to get better from a public health standpoint. We also need to keep families afloat, and with the relief to not just households, but I think there needs to be more relief going to state and local governments, getting it to schools so that they can open safely, so that they have the resources they need to be testing and feeling safe to reopen. And then that will help businesses reopen. It'll help people feel safe to go out again and to go back to work again.
This is a tough question, but just on that, I want to ask your opinion on, should a next round of, let's say there is another big bill, should it be more shifted towards getting money in the hand of individuals rather than trying to keep businesses afloat? Because it just occurs to me that a lot of money going to businesses may be going to businesses that are ultimately going to go out of business anyway. And
right. Right.
So maybe the money should be more directed at individuals because they're going to have to find new jobs or maybe move to find another job or something.
Right, and it's individuals, it's households that buy the goods and services that determine which businesses will survive versus which businesses will go under. I believe that's right, that more should be given to households, but also more needs to be given to the human services that are provided by government, which means schools, public schools, not just colleges, but public school, K through 12 schools. And there needs to be more resources given, maybe to businesses to provide more childcare options within their businesses and organizations. So I think whatever helps provide care for it's like the foundation of our economy is the people, and we have to have people taking care of the kids and the elderly parents before the working age population can get back to work. And so I think steering resources to both caregiving and to households is very important during this period of time while we wait for, the vaccine to take care of the rest.